What is your mucus trying to tell you? I'm Elizabeth, and today I'm going to decode what the color of your mucus, as well as the consistency and what it looks like, really means. If your mucus is clear, guess what? It's completely normal. Mucus is made to actually trap pathogens and different things before they get into your body. So the clear mucus that you see, that is just a defense mechanism of your body, and it is completely normal. Now, when mucus starts to turn white, it usually means that it's a thickening of the mucus. And while white mucus is normal and it doesn't really mean a whole lot other than the fact that it does typically show you that you're becoming congested. Now, if your mucus has started to turn colors and is a light shade to a straw shade of yellow, guess what? This means that your immune cells have arrived. So that being said, this happens when your body is trying to fight off some sort of an infection. Now, if your mucus has progressed to green, this shows you that you have a higher concentration of immune cells, as well as enzymes. This is quite common in viral colds as well as infections, but it doesn't necessarily mean that it's viral. So this can happen in both bacterial and viral infections. Now, brown mucus. Brown mucus looks really bad, but it's not really that bad. It can either mean that you have some old blood in there, or it could simply mean that that mucus has been trapping a lot of particles, keeping it from your body, and it just simply is either old or it's helped trap a lot of particles and smoke. Now, this one is probably pretty obvious, but if your mucus is bright red or it has red tinged things kind of going through it, this does indicate blood. Now, this could simply be from your airways being dry or excessive amounts of coughing, and then any type of trauma to your lungs. Also, your nasal passages. So this isn't always alarming in and of itself, but if it is a large amount of blood or it persists, you do need to seek medical attention. Now let's talk about consistency. What I mean by that is your mucus thick and sticky and hard to get out, or is it thin and runny? Now, thin and runny usually indicates an acute viral infection or allergies. If your mucus is super thick and ropey, this means that your body is dehydrated. Drink more water. Now, thick clumps that come out with color, this can indicate an infection. Maybe you're even over the infection, but your body is just now getting rid of the mucus. If you notice that your mucus has a really bad odor, this indicates some sort of a bacterial infection. This would indicate more than likely that you need to see a medical health professional and get treated. Now, if you notice that your mucus is frothy and has a whitish or pinkish color, that is something that you would want to talk to your healthcare provider about, because it could be indicative of a heart problem rather than a lung problem. Now that you know what your mucus color means, I want you to watch yourself this spring so that you can keep on top of everything and you don't suffer from any unnecessary illnesses.